Hi there, and welcome back to the Airplane Spoon podcast. Real stories and real questions about feeding children. I'm Sarina Murrell, a feeding therapist and director of the Airplane Spoon. And today's question is, what do I need to know about bottle feeding my baby? Now, last episode, I talked all about cups. So I thought today it'd only be fitting that I go a little bit younger and talk all about bottles. Because just like cups, there is just as much variety, options, confusion, and information that isn't always shared with families up front to know what decisions to make that would be the best fit for your child and for your family. So, for some families, bottle feeding just works. You fill up the bottle, give it to the baby, and they eat. Done. And for other families, there are a lot of challenges. There could be a whole cupboard full of all different types of bottles that they've tried, different types of the flow, the nipple size, different formulas, and people trying different positions, different rooms, white noise, all these things to try to get bottle feeding to work better. And so today, I want to talk to you about some of those topics around bottles to give you just more information so you can feel more confident and empowered around supporting your baby in their bottle feeding journey. So, some things that nobody maybe told you in the beginning, or maybe you've never considered. Things like, does it actually matter how you hold the bottle? Or does the nipple size matter? And what does that mean? Or if your baby is gulping so fast and then spitting up, what can you do about it? Or why does your baby suddenly seem to hate the bottle and be refusing it? Or should I buy yet another type of bottle? So, today's episode, I will walk you through what I think every parent should know around bottle feeding, from how bottles are designed to different techniques and to what to do when your baby starts refusing the bottle or has some other signs of physical challenges with feeding. Whether you're exclusively bottle feeding or combo feeding, breast and bottle, or just starting to introduce the bottle alongside breastfeeding, this episode is for you. Let's jump in. So, before I get into the specifics, I want to share with you a lens that I use with a lot of families around feeding practice. And this is the idea about the products that we buy. If you haven't heard me talk about it before, I'm going to talk about the idea of parent products and child products. And I'm going to go over this briefly, but I say this a lot. So, a parent product is something that's designed primarily for the convenience of the caregiver. It makes feeding easier or less messy or more manageable for the adult. And there's absolutely nothing wrong with that. Parents need support. But parent products are also designed to get parents to buy more. And so sometimes you'll see this, for example, with packaged baby food. They'll have ages on there, right? They'll have that this is for 6 to 8 months, and then 10 to 12 months, and then 12 to 18 months. And the idea behind that is so that parents will see that and think, oh, my baby is now this age, so I need to buy this next level of food or this next level of bottle size, nipple size. There's a lot of products out there to get parents to buy more of the product, especially around feeding. So, a child product is something that's designed with the child's development in mind. And for feeding, this is thinking about their oral development and their feeding experience. It supports the way that their mouth, their tongue, their jaw are all learning to work. And sometimes the product can be both, and sometimes it's one or the other. And understanding which category something falls into can help you make more informed choices rather than just grabbing what is most popular, what is best marketed, because the marketing for parents is real. Parents are a vulnerable population because they're worried. They want what's best for their child. And when we're worried, we don't know what to do. And we hear this messaging of, if you buy this, this will help your baby. And then parents buy it. So I'm sharing this with you right now up front to talk about that the way that bottles are designed is not only for the baby in mind, it's to get parents to buy. And the more information you have, the more confident you will feel about, I don't need to change it if it works. I'm saying this right now, and I'm going to repeat this throughout the podcast because if it works, then you can keep using it. All right. So now getting into bottles, you will know if you do any online search or if you walk into the baby section of any store that has bottles, it is overwhelming. There are hundreds, if not thousands of brands of bottles out there. And then there's all these different types. There's like angled bottles and then wide neck bottles and then standard or narrow neck bottles, vented bottles, anti-colic bottles, slow full flow, ultra slow flow, bottles that look like nipples, bottles that are glass, that are plastic, that are silicone, and have all these different types of slogans. Most like breast, helps with reflux, most natural flow. And here's what I want you to know. The bottle itself matters less than how you use it and how it works for your child. Parents ask me all the time, what bottle do I recommend? And my answer? The one that works best for you and your baby. Now, there are different bottles out there that have different functions, but for the most part, if it works for your child, that's great. With that said, there are a few things about bottles I will talk about today so that you can feel more equipped when making decisions about which bottle to buy. And some of these things are the nipple shape, whether that's a narrow standard neck or a wide neck or a breast-shaped bottle, the material and shape of the bottle itself, the vent systems or anti-colic systems, the size of the bottle, and the most controversial and most important is the nipple size. But the honest truth, there is no single best bottle that works for every baby. And if you see marketing around that every single baby loves this bottle, it's just not true. What works beautifully for one baby may not work for another. And if you found a bottle nipple combination that your baby accepts comfortably, feeds well from, and doesn't seem distressed after, that's the right bottle for your baby. Okay, so let me get into some of these topics. For nipple shape, which is kind of the top shape, what I want to show you is that there are two basic ones. There's kind of three. The first one is a standard neck nipple. Now, it's not about the brand or anything. It's just like this one is a little bit smaller. And the idea behind this is that the whole thing can go in your baby's mouth. And that's fine. It can go all the way up, and their lips can be touching the base of the nipple and go all the way in. And then they make these more wide neck ones. If you look at the comparison here, then the wide neck ones are wider. And the idea behind this is supposed to be more breast-like, and that maybe the baby is getting just more of the whole nipple head in their mouth when they are sucking. And, the research out there does not conclusively state or show that one is better than another. It really just comes down to kind of preference. And there's also ones that are even wider than this, and they supposedly just like imitate a breast, that they look very much like a breast. They're even wider and squishier. And that's the marketing piece that they're going for, that this is a standard kind of classic bottle. And then when they did this, it's more breast-like and then even more breast-like. Well, the difference is that the way that we feed on breast and the way we feed on bottle is very different. in the mouth and how that works. And so even if the shape of it is more breast-like, first of all, babies are gonna know the difference, and it's not going to, like, be the ultimate you're not confusing them. This idea about bottle confusion, especially if they're breastfed babies and you're trying to get them to take the bottle, maybe going back to work or, having other caregivers try to feed them as well. It the shape of the bottle that it looks like breast isn't going to help the child to understand that it's not breast so much, because the feeding is different, and obviously it's this object, it's not a person that the milk is coming from. But that's kind of the idea behind that in terms of the sizing of it. Now, when we're talking about latch, some people believe that the smaller size standard bottle, babies can latch better, and that with the wider bottle that they don't latch as well because it's more for their lips to seal. Again, there's no evidence behind this. This is just what people think. Um, because the breast itself is very large, and so the latch itself of the lips is less of an important role in feeding than how deep the bottle is going in and how the tongue and jaw movements are happening. So, in any bottle that you use, it is important to try to get a very deep latch. You don't want the baby just chomping at the tip of the nipple because they're not really going to get that much and they're probably going to get a lot of air and get very gassy. And so, going all the way in, that's going to shoot the milk to the very back of the throat to have more effective and kind of reflexive swallowing as opposed to having to move it from the front all the way to the back of the throat if they're just getting it at the tip. And they're going to be dribbling a lot. They're not going to have a very good pattern of rhythmic suck, swallow, breathe, suck, swallow, breathe, suck, swallow, breathe, suck, swallow, breathe. And so, with any bottle that you use, the most important thing with the tip of the nipple is to get it as deep as possible, all the way in. Don't worry about it. You're not going to gag them. When a baby is breastfeeding, they're pulling that nipple all the way to the back of their mouth, sucking it all the way back. And so their bodies are designed for having it deep in their mouth. And so that's okay. You can do that to keep going in further. That is kind of the nipple top shape of the first consideration of bottles here, right? What do we put on top of the bottle? Okay, so the next thing about bottles that I'll talk about briefly is the material of the bottle. And that is the main materials are plastic, glass, or silicone. And the idea of silicone, which is more relatively new for the bottle itself being silicone, is that it's supposed to be very squishy and moldable like a breast itself. But like I just talked about, the act of drinking from a bottle and the act of drinking from a breast is very different for a baby, and how they pull out the milk and the milk flow and how they swallow it. And so having the bottle be squishy like a breast isn't really going to kind of trick a baby to think that it's a breast because in the end, it is still a bottle. And so that's marketing. If that works really well for your family, that's great. It's not that it's wrong. It's just that it's designed that way to try to market for parents that are worried about like nipple confusion or bottle confusion or breast to bottle. Having the bottle be more breast like isn't necessarily going to be what makes that most helpful. And I would say largely most bottles are plastic, and many people are moving away from plastic now for fear of microplastics, heating up the plastic, and that's why many people are turning to glass. And glass is not going to hold any of the smells or stain the way that plastic would. But obviously, there's a risk of glass breaking, and also glass is pretty heavy compared to plastic. And so, plastic would be more supportive for a child holding it, or silicone for a child or the baby, a little older baby, to be holding it themselves, the glass would be pretty heavy for them to hold. But if an adult, a caregiver, parent is helping them to hold it, then glass could work just fine. So that's just a personal decision and maybe just based off of your family's values of what kind of materials you want to expose your child to or what's available to you. And also cost wise. Typically, the plastic bottles are the most cost effective versus glass and silicone tend to be more costly. The next one I want to talk about are vent systems. And the first thing I'll say is that a lot of bottles have a vent bubble system built into the top of the nipple topper. And you'll know that because there might be a little dot, like it might just be an extra little dot of the silicone of the nipple itself. It might be a little like ball of hard plastic on the rim of the nipple, um, or like a little kind of cutout half moon shape. And if you see that, the thing is that this isn't very well explained, but that technically is supposed to be the top. And that's where the bubbles would help to come out when they're drinking to pull the bubbles up. And so if you are looking at the top of your bottle and it has any of these little kind of dots or marker on the edge, that's the top. That's where you point towards the nose. In case you didn't know that. But some systems have it built into the bottle itself. This is a Dr. Brown's bottle, and this is their classic venting system, anti-colic system, and different bottles have different a- additions or pieces that go with it. Usually it's kind of like a tube that goes inside the bottle and then the nipple head screws on top of that. And the idea behind this is that it draws out the air to the back of the bottle. And so the air bubbles are not filling the nipple head itself so that the baby gets less air swallowed for them to be less burpy. And so we know burping is part of feeding a baby, and some babies are a little bit uncomfortable when they're very gassy. And there's a couple of things. It's not just the bottle system itself. Some people don't like these systems because it's a lot to clean. There's lots of different pieces to it. Um, and that's fine. Having a bottle without any of those systems, you can check to see if they have the hole or the little dot for the top of the bottle. But a couple of other tips to make sure to see if your baby is really gassy or not is there always a full top of milk in the nipple head? That way it's not half full where every time they're sucking, they're getting a lot of air. Um, and having them in different positions could help with how much air they're swallowing. But there's lots of different strategies out there to support. If you have a very kind of gassy, burpy, upset, colicky baby, it's not just the bottle itself that could fix that. There's other things that the adults, the caregivers, the parents could do to help. And then the size of the bottle is also important because there's can be too small of a bottle, and then you have to make another bottle, and that's going to disrupt the act of feeding. If you have a small bottle that maybe only holds, 4 ounces, and you prep it, and your baby eats all of that, and they're ready for some more, well, the bottle is limiting how much, as opposed to having a little bit of a bigger bottle size that could then be prepped. You don't have to fill the whole thing. If you have an 8-ounce bottle, you could do 5 ounces or 6 ounces. And instead of having to go prep a whole nother bottle. But you don't really want to have an 8-ounce bottle if your baby is only really taking 2 or 3 ounces because it's going to be hard to be very accurate with the filling of the water or just measuring how much they took because it's meant to be a bigger volume. And it's going to be heavier. It's going to be really hard for baby to hold on to that if they're still very little. Um, and so it's just something to consider about the size of the bottles. that there are smaller size bottles and then there are larger size bottles. And that one might be more helpful as your child grows and is drinking more per feed. And the last one that I want to talk about is nipple sizes. Nipple flow. This is something I talk about constantly with families and doctors and other medical providers because I think that there are many ideas around this that are misunderstood, not well known, and sometimes incorrectly being recommended. Now, I'm sure you know that nipples can come in many different flow levels, bottle nipples. Sometimes they're labeled as like slow flow, medium flow, fast flow. Sometimes there's numbers, like a 1, 2, 3, 4. Sometimes they have like ultra slow or preemie or newborn flow. And the general guidance on the packaging is that you move up in the flow level as your baby gets older. But if we think about it, if a baby is purely breastfeeding, the nipple, the flow of the nipple does not change as the baby gets older. It does not get wider. And if you and I were really thirsty and we're going to drink out of a straw, so it's not like I'm only a little bit thirsty. I'm going to drink out of one of those really, really flat coffee stirrer straws because I'm a little bit thirsty. Oh, I'm medium thirsty. I'm going to drink out of a standard straw. Oh, I'm very thirsty. I'm going to drink out of a bubble tea, a boba tea straw. Because what happens, think about that. If you're so thirsty and you drink out of a very, very wide straw, you are probably going to get way too much, way too fast, and cough on it. So the thinking is backwards. Not backwards so much, but it just doesn't make sense that we need to have a bigger hole and a faster flow just because the child is getting bigger. The child is getting bigger. If they want to drink more, they just suck more. They just kind of suck harder. And so you do not have to move up in nipple flow just because your baby is getting older or at all if what you're using is working well. Faster flow is not necessarily better. And in my professional opinion, I would say in most cases, faster flow is harder. Faster flow means the milk is pouring into your baby's mouth more quickly than they may be ready to manage. And sometimes this can lead to gulping and swallowing of air. It could lead to gagging or just kind of coughing during feeds. It could lead to that the feeds are only lasting 3 to 5 minutes, which sounds convenient, but it's actually concerning. A baby should not be eating their full meal in such a short time. There are systems in our body that have to register and happen for that natural, gradual stretch of the tummy to signal fullness to happen. And it's like if you and I were to eat a meal in 3 minutes, it's not that we can't do it. We probably could do it, especially if it was like a giant milkshake or a smoothie or something, but it's going to feel pretty uncomfortable. So that uncomfortable feeling might be related that it's too fast. It could also result in more spitting up or even fussiness and reflux-like symptoms after a feed. We want a bottle feed to last between, on the very fast side, I would say like 10 to 15 minutes. Standard side time would be around 20, 25 minutes. A little bit longer side might be 30, 35 minutes, 40 minutes. That's a longer feed. But, anywhere between 10, 15 and 30-ish minutes, 15 to 30 minutes would be that time for a meal. Similar to if you and I were to eat a meal, that's the sufficient time for that gradual stretch of the tummy to signal to the brain the hormones of fullness of I am now content, I'm full, I can stop, and I'm ready to digest. The timing allows your baby's body to pace themselves and to digest comfortably. So any feed that's kind of under 10 minutes, especially under 5 minutes, doesn't give them that time to have those signals. And I want to say something about reflux. Many families I work with have babies who have been diagnosed with reflux, and they're managing it with medication. And sometimes there's like a positioning change, or lots of times there's also formula switches, or maybe adding in formula into express breast milk if that's what the family's using. And so, one thing that's often gets missed in the conversations around reflux is that can be connected to overfeeding. Overfeeding can happen easily when the milk flow is too fast and the babies are finishing their bottle before their body has time to register fullness. Slowing down the flow and the feed itself is one of the first things that I address when a family comes to me and the baby is struggling with reflux. So, if you think about it, if you're eating really, really, really fast, your body's like, oh, that's a lot of food. And it shoots out more acid. And that acid is going to make us feel very uncomfortable. And this is when babies get kind of writhy and archy. And that's not necessarily that their body isn't handling the milk and the acid well. It could be that it's too much or it's too fast. Slowing the flow is one of the first strategies I recommend for a lot of babies that have feeding challenges. Because if they have coughing and swallowing concerns, it might be too fast. Their body might not be protecting their airway at the back of the throat when they're swallowing. And that's why some of it might go the wrong way and they're coughing on it. And for sometimes these babies, they might have a swallow study, and there might be recommendations to thicken the milk or the formula to slow it down. Thickening slows, but slowing the flow to make it come out less can also help with those swallowing concerns. Now, it is important to keep in mind if you do thicken and lower the nipple size down, that's going to actually create a harder effort to get the milk out. So there does need to be a consideration that if you are thickening, that you might need to go up in nipple size just to get the milk out, because it's kind of like trying to drink a milkshake through a straw. You have to suck really hard. So in those cases, having a little bit of a wider straw, of a wider hole, might be more beneficial. Because the other thing I hear all the time is that my baby is struggling to finish their bottle and it's taking us an hour or longer. And so they went up in flow. And now sometimes these babies are on, a level 3, a level 4, a fast flow nipple, very, very fast. And thinking that if it comes out faster, that's going to help them to eat better. I understand how that could be thought of as beneficial, but I'm here to tell you that most of the time it's not. And by slowing the flow down, people are worried if we slow the flow, it's going to take longer. That's not necessarily the case. If we slow the flow, that the body feels safe and that baby can draw out the milk in a confident and comfortable way, they will eat comfortably and they will eat smoothly and efficiently. But if every time they're trying to eat, it's just they're choking on it because it's just too much, they're drowning in the back of their mouth, they're going to refuse. And it's not that making it faster is going to be the solution. So thinking about the size, the flow of the nipple, the size of the nipple opening, in this case, the hole, is very important. That it's not something that is necessarily just designed for age. That really doesn't make sense at all. That's a parent product. You do not have to go up in nipple size because of their age. I've had some families where there's a 10-month-old baby and I'm recommending a level 1 flow, and they're like, "No, that's for 0 to 3 months old. Our baby's 10 months old." And they think that, "No, that's bad. We can't have that." That's the marketing because that's what the box shows. But if this is something that your baby seems uncomfortable with, especially during feeds and it's taking a long time, they're arching, they're very uncomfortable, having a conversation with your pediatrician and getting a referral to a feeding specialist or a feeding therapist could be really helpful to see if your bottle system could be changed to support them. But my bottom line on the nipple flow is to start slow, stay slow if it's working. Faster is not necessarily better, and a quick feed is not a successful feed. So, this brings me to the idea of some external strategies that we can do to support bottle feeding with a baby. And I've got a couple of ideas here to share with you in case you haven't heard them before. The first one I want to talk about is how to hold the bottle. Now, I have a baby here. Hi, baby. A lot of times I see parents are holding the bottle at the end of the bottle, and they have the bottle here. They might even just have like 1 or 2 fingers on it, or maybe just a couple of fingers on it, and they're holding it at the end. So what this does is it creates a very um, big fulcrum, basically an angle that has a lot of movement to it because my arm is at the back of the bottle. And so this bottle can move all over and it's not very stable. So, what I recommend is a pencil grip. However, you are going to hold a pen or a pencil or a marker up here at the top of your hand is how I recommend holding a bottle. If you hold a bottle right up here in your fingers at the palm of your hand, and then you put that bottle in your mouth, there's very, very, very little movement that's happening because you're very, very close to the point of getting that all the way in the baby's mouth. It's not moving very much versus up here at the end, it's moving all over. And so holding the bottle is important. The other thing about this that I really love is that when our hand is really far away, our babies can't really touch our hands. But if we bring our hand closer to where their mouth is, a lot of times you're going to see their hands reach up. And you can also just kind of grab onto their little hand with your fingers and have them hold their hand while they're eating. And this is a very, very sweet thing to get their hands involved and to make that more um, supportive of the bonding and the relationship that happens with feeding babies. So holding a bottle. Okay. Um, Another thing is where you're going to point the bottle. So sometimes people point the bottle at the bottom or in the middle of the mouth. And this might cause the baby to pull off or to wiggle around. But to stabilize a child's latch on the bottle, we actually want to point the bottle up at the top of their palate. If we point it up and hit their palate, that's going to allow their tongue to wrap around it and to really try to pull it in deeper for a stronger latch. Another thing about how to get the bottle in, a lot of times, first of all, sometimes people just kind of grab baby, grab bottle, boom. And it's like, whoa, 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 what's going on? And if you think about it, if you're just sitting there and somebody like shoves a spoon in your mouth or puts a cup in your mouth, you're like, whoa, they didn't even see it coming. And so I really like to have parents to show the bottle to the baby of like, it's time to eat. Now, if baby has some kind of negative experiences around bottle feeding, and as soon as they see it, they get fussy, that is your concern to bring up to the doctor to see if a feeding specialist evaluation is warranted because we do not want that to be happening. We want the baby to see the bottle and to show signs of like leaning in, reaching, fixating on it, even their tongue starts to pump, that they're ready for it. To see those readiness signs, then we can feed. Now, a lot of times what I say is you want to try to create rooting. When a baby's at breast, they're trying to find the nipple, and this is called rooting. They're turning their head to get it towards their mouth. So you can tickle their cheek, either cheek with the tip of the bottle, and the baby can turn and then open their mouth to get the bottle that way. You could do the chin or you could do the bottom lip even. Um, but don't just pop it into an open mouth, especially not if they're yawning or crying. Those are mechanisms that happen, and think about it yourself. If you were yawning and somebody shoved food in your mouth, that's really scary. And that's not what's supposed to happen if you're in mid yawn. And if you are crying, you don't want food in your mouth. You're having an upset moment. It is not a time to eat. And that's probably going to lead to a lot of coughing because the body is not ready to protect for eating. So just wait a second and then go to the sides, go to the bottom lip. A lot of times I say to parents, avoid the top lip because the top lip might create this kind of pullback response. Um, it's a little bit more tickly. And so kind of staying on the bottom lip, chin area to see if they'll pop open that way. Um, for positioning, there's lots of different positionings for bottle. And when babies are really little, they can be fed laying flat. This is our bodies allow for it. Our bodies itself have babies have very little neck, and so they can breathe and eat at the same time laying down. And as they get older, we're going to have to bring them more and more vertical, just because their necks are lengthening out. They have more space, and we don't want them to cough. While they're swallowing. Just like for you and I, it'd be really hard if we were laying all the way flat trying to drink. We need to sit up a little bit to help gravity to pull it down. And so having a more upright position can be more supportive if you have a baby that is a little bit um, more, coughing or not as comfortable. There might be reflux as well, that the acid is pulling up when they're laying flat. And you might even see this with diaper changing, that they really don't like to be laid flat. So you don't have to feed them flat either. Having them in a more slightly inclined position could help to have that acid pull down. Side lying is also a very um, successful or popular position where the baby is on their side and they're being fed sideways. So it'd be like if you and I were like laying sideways in bed and we were trying to drink that way. What this does is it allows the milk not to fall in the back of the throat, but in the cheek pocket to pool to then have them swallow when they feel ready. So they're not getting kind of overwhelmed by all the milk hitting at the back. But there's lots of different positioning and um, whatever feels most comfortable. And it's totally fine if one caregiver, whether that's, a parent or a grandparent or a nanny or a daycare provider, feeds one way and then another person feeds a different way. Totally fine because the baby's going to get used to how am I being fed with this person, as long as that baby is comfortable, is confident, and is taking their food well. Um, so one thing I talk about actually that can be very helpful is to switch sides. So sometimes babies are always fed on the side opposite of the dominant hand of the feeder. I'm a right-handed person, so I would have my baby in my left hand and feed with my right hand because our handedness makes it more comfortable. Um, and But babies that are breastfed and naturally are often switched sides. And this is really important for the body and for us to have a little bit more symmetry. So if you can, halfway through the feed, it can be halfway, right? They could switch sides, or you could do alternating feeds. A lot of times there's tricks that breastfeeding mothers have of like putting a hair tie on the arm of which breast did I feed last time, and then I'm going to feed the other breast this next time. um, but that can be really helpful, not just for their kind of symmetry of their muscular development of their head and neck and face, especially if they have what's called torticollis, if they have some stiffness on one side of their neck, that can be very helpful. It can be very helpful for the caregiver that one arm, the other arm itself doesn't get kind of more tired or feel kind of weird because you're always straining the arm holding the baby. Um, and it can also create a very natural movement shift pattern for burping. Sometimes just moving the baby can create a burp, right? Just 'cause you're shifting the tummy. And so that it could burp to get them back over. Um, One final thing I want to talk about before I wrap up today is that a lot of times families talk to me about my baby seems hungry constantly. They're always sucking. And it's important to know that babies have a very strong sucking reflex, and it's separate from hunger. Sucking is comforting and regulating for babies. This is why they can suck on a pacifier, they can suck on their thumb. Sometimes they just kind of suck on their mouth. But it doesn't always mean they want more milk. So, learning to read your baby's fullness cues, for example, turning away, slowing down their suck, have more relaxed open hands, a quieter body, kind of going into sleepiness. It takes some practice to learn, but it's one of the most valuable things that you can do for your baby's long-term relationship with food. So again, we don't want to be overfeeding baby as well. Just because that they can take more doesn't mean that they're actually needing to take more. And that can lead them to be very uncomfortable or to produce a lot more acid. It's kind of like what I say to parents is that if you had a bowl of chips, you're going to eat it because it's there, not necessarily because you're hungry. And you could be just finished a big meal and you could still eat a bowl of chips or ice cream or something because it's there. And so it doesn't always equate to hunger. Sometimes families are filling a bottle and then they want another bottle and they take it. It's a reflex. They're going to take it because it's there, but it doesn't mean that their body actually needs that level of volume for their meal times, for their feeds. Okay, so I want to talk about one challenge that pops up a lot, which is bottle refusal or bottle aversion. Now, I'm saying both of these terms because a lot of times these terms are often confused or used interchangeably. And there's like bottle confusion or bottle refusal for breastfed babies. If you're trying to get them to take the bottle and they just really don't want the bottle, that's different. That just they don't really understand and they maybe prefer the breast. But what I'm talking about more so is not the confusion or just like the I don't know what this is, but it is the negative association to feeding to the point where it doesn't really happen, right? When a baby has either been taking the bottle and then stopped, or they're just closing their mouth, they're turning their head, they're crying, they're trying to push it away with their hands, and it's just not happening. And this is really important because it's very, very stressful for the caregivers, for the parents. It seems like that something is wrong. And it is important for us to read those cues because maybe baby is trying to tell us that something is wrong. If they have intense emotional response, right, crying at the sight of the bottle, only drinking very, very tiny amounts, or maybe only really feeding when they're really drowsy or sleeping, this could be a sign of some sort of underlying feeding challenge that it's not the bottle itself. It might be something going on with baby. Now, this could be a gut reaction to sensitivities that their body's not really able to process, whether that's like milk proteins, um, or some sort of food that might be in the mother's diet, like if they're getting breast milk, if it's like, soy or fish or something in the mother's diet that we're trying to figure out and that's causing a lot of discomfort and challenge for the baby and so they don't want to eat more. The brain is telling them no. It could be something related to their swallowing and that they're not protecting very well. And maybe that little tiny amounts of milk might be going the wrong way, like aspiration. And their body is saying, no, 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 no. It could be their acid levels. So we talked about reflux. And finding out what's going on with baby is really important because sometimes the feeding refusal is not the food, it's not the bottle itself. It's what's going on in their bodies. And so talking to your child's doctor, possibly getting a referral for a feeding specialist, an infant feeding specialist, can help to try to figure out what is going on because feeding should not be so stressful. And it should be very enjoyable. It should be a bonding moment for the adult caregiver and the baby. It should be very relaxing and satisfying. And so if you're seeing these cues, don't force it and bring it up to your doctor, sooner rather than later because it can spiral and get worse and worse to where baby is losing weight. And we're very concerned not just about their enjoyment and their emotional experience, but their physical need as well. So, bottle feeding is one of those things that can look simple from the outside, but has so many layers once you're actually in it. I hope today's podcast gave you a clearer picture of what to pay attention to and what to let go of and when to ask for help. The biggest thing to take away is that you don't need to change a bottle just because your child is getting older. Slower is almost always better. And if your baby is struggling with the feeding, there's almost always a reason. Thank you so much for being here and listening to the Airplane Spoon podcast. And remember, you're doing an amazing job supporting your child on their feeding journey. You've got this. Love, enjoy, and eat.